Hi everyone. Thank you so much for watching this episode. This is the special episode about the true medical billing blueprint that I'm running right now. And it's a special episode that is basically for the providers who are out there, the new providers, or maybe the established one too, who are actually, we find out recently that sticking with the platforms out there, like, the third parties platforms like Headway, Alma, and other platforms out there. And today I'm with Dr. Leonie over here. Dr. Leonie is actually a wonderful person. We will be breaking down today what exactly happening behind the scenes, discussing a few things with him. Thank you, Doctor. Thank you so much for joining me today for
Hello.
this special episode. I would really appreciate if you can give us a little bit introduction about yourself, about your experience to the audience, so we can take it from there.
Okay. Well, just like your new doctors that are just getting ready to come out of school and existing providers that are already practicing in the field, I have been in your shoes both ways. My name is Dr. Klapman. I'm a retired podiatrist. I've been practicing for almost 20 plus years, exclusively in the field of house call podiatry, which is very much you have to have everything very much mechanized and oriented, and having a good, solid team behind you, such as a good, solid biller, goes a long way with that. So today, hopefully, we can sit here and show you ways in which we can make it much easier for you and make it more realistic for what a practice should be and not what people are telling you a practice is supposed to be.
Certainly, doctor. That's what we're going to do today. And again, I've seen a lot of these new providers who are actually, even the mostly like mental health provider, the therapists out there who are just starting out, get out from, there, and maybe they had this hurdle in their mind that either they should go as a new practice out there, either they should join a platform and, stick with that for the viewer, just to make things simpler. What's your thoughts on that? They should.
Well, starting out, it's very tempting to go with the easier route. In this case, going with somebody who will help easily organize your practice, provide you with stellar billing, but in exchange for that, um, may also entice you with providing some kind of patients to add to the practice, but now you're maybe locked into your contract with that provider. That's not with that software or that biller. And that's not how it's supposed to be. The way it's supposed to be when you're starting out is you go, you put out your shingle, and then you go to the biller and you say, I need help doing something that I have no idea what I'm doing. How can we maximize the profits that I get from my patients, but at the same time make sure that I can keep my doors open so that I can practice for years and years to come? And that is what's supposed to happen. You're supposed to, when you start out, pay a percentage, and then for every dollar that you make, your biller gets a small percentage of that. And that's the way it's always has been, and it's always has worked. Everything else is just kind of like it's a poor facsimile of the way it's supposed to be. You're supposed to go to school, get good grades, learn how to become a healthcare provider, go out and treat your patients, and most importantly, be able to have a self sustaining business entity of a practice that is yours and yours alone. You should never have to hand it off to somebody else unless you are not in a position where you want to do that. And I can understand there's some people that are built that way, but most people are the opposite. They are independent providers that want to go out and do a good business and make sure that they hold on to the business and have repeat business over and over again. And that is what will separate one biller from another biller, in my opinion.
Indeed, indeed, because I've personally seen a lot of the new providers out there, even though we go day in, day out with these providers, the therapists out there who are actually coming out of from these platforms. Some of them are still sticking there and they want us to take care of the partially initially to just see the things, how it goes. They don't want to take care of that, burden of credentialing and all that headaches and everything. And that's the reason actually we let them know, okay, you want to go partially, first of all, we guide you about it. We educate you. We'll let you know what exactly the pros and cons if you don't go independent. Because down the road, you should supposed to have your own identity. You should supposed to have your own ownership. So regarding the insurances should supposed to know that they exist, right? They should supposed to know that this is the practice out there who are exactly in the business from that much time long, and they should get paid accordingly. And they should also, after a while, when they're in business, they should add more providers, negotiate their rates with the insurances by themselves. But maybe if we are doing that on the behalf of them, we will be representing that provider out there, and that's why they will be having their own goodwill instead of handing your own business to someone else's hand and you're working as an employee over there. Your patients aren't yours, your contracts aren't yours. You don't have an ownership. You will be having a deficiency of transparency. That's what I've seen so far based on our experience. That And again, you won't be able to recognize our true revenue out there because you don't know what exactly you're getting. You're just a therapist out there, and you don't have an existence of your practice on the websites of their these platforms out there. So I believe it's good to compare, compete, contrast with others out there. Even just maybe on some point, you should go out there and see what exactly you'll be getting, from the value from the market. You just, even if they're in a new practice out there, I understand they don't want to take a lot of burden on themselves. They're read in a medical school. They want to treat the patients. That's something that's their specialty, right? But again, it's always good to have a second opinion and have someone on your back who can actually guide you step by step about these things instead of just letting someone take care of your bread and butter. I believe it's nice to learn about that from them who is expert, who can guide you. Like, this is how the contract works. This is something that you're getting with insurances. And this is how you get paid for your own CPDs and all that stuff. And now you're treating the patient, but like what exactly is going on the behind with my practice too. This is my business, right? So I've personally seen a lot of examples. Recently, one of my therapists was from these kind of platforms out there, and I have seen that we started partially with her. She wanted us to take care of, start getting her enrolled as individual practice out there. She wanted to leave that platform, and that was a good decision because we have seen a significant, reimbursement, higher reimbursement over there, maximization on that side. Because if you're getting, let's just say, for example, $120 from these platforms out there, Headway, Alma, or other things, now independent contracts, you're making 140, 160. It's a huge difference for a provider who's just starting up, right? What do you think, like, what will be the transition fear these practices might have as a new practice out there? Why they're still sticking with, these third parties out there?
To be very frank, as doctors, we are little kids. We like things the way they are and we don't like to change. And when we have to change, we stomp our feet a lot. And that's the mentality of what we are. That's the mentality you're dealing with. So that's a lot of times why people will stay. It's very comfortable to stay with some a known entity versus going off into a new entity. But as somebody who actually has gone through that, I started out in practice where I worked for another provider. And I did that for about a year to a year and a half. And every day I'd come home, I'd complain there's not enough patients. Why am I sticking with this practice? I know I keep sticking with it because it's something that's guaranteed income, but am I really maximizing my full potential as a doctor? And the answer was no. So my wife said something very simple. She said, you're seeing more patients after hours outside of the practice on a house call basis than you are in a practice where you're being provided a salary, but you're not making nearly enough of what you would make on a house call basis. Go be a house call doctor. So I said, okay. I had an office in Beverly Hills, closed the office in Beverly Hills, never looked back, and continued practicing 20 plus years. The point is that
Mhm.
when you make decisions when you're starting out, it's all about informed consent. And if you're a doctor, you know exactly what I'm talking about. You want the fullest picture possible, just like you would put the same expectation, or the patients that you treat put the same expectation on you. You want to know all the facts before you make the decision. So going with one biller over another without looking at all the different categories of what's available is not giving you the best outcome possible, which is what you want, which is what most of your colleagues, such as myself, want for you. The more of you that are out there, the more we expand the profession of medicine and more people get to know what the profession of medicine is about. So the goal is stick around as long as possible, do good work, and make sure you're getting properly paid for the work that you do. And that's where someone like Mohammed comes in. Very good at making sure you're getting the maximal reimbursement that you're supposed to get. For example, the last example I showed you, where you're, say, for example, at another biller where you're getting $120 on a negotiated rate versus where you're supposed to be, say, at 140 or 160 on a
Yeah.
negotiated, say, 60. At 160 on a negotiated rate, you're leaving $40. $40 to most doctors doesn't sound like a lot. $40 now, what is it? It's dinner for two at a mid-priced restaurant, so it's not that big of a deal. But $40 when you're making 160 on a practice, or sorry, 120 on a practice, and you're leaving 40 on the table, that means you are leaving 33% of your money on the table when most billers are not charging you 33% to do
Right.
your bill.
Indeed.
So it
You're
doesn't make any sense at all to do that arrangement. Yes, in the short term, it makes you feel good. It makes you
mhm.
gives you a little bit of legs while you find your um, while you get your sea legs in practice. But once you get your sea legs, pitch it to the side as quickly as possible because
True.
what's going to end up is you're going to build a house of cards with nothing to stand on.
True.
And at the end of the day, at some point you will retire. I guarantee it. You'll either retire or you will die in your chair like a good doctor does. Sorry for being morbid, but that's how
Um,
my mentor out. That's how I wish to go out.
indeed.
Um, Sorry, but the point is you want equity while you're still here, but you also want equity because your practice has equity in it. And if you turn your practice over to somebody else to run instead of
True.
running it yourself, you're leaving equity for your future offspring that they
True.
can reap the benefits of. If you give the practice to somebody else, there is no money left on the table.
Exactly. You're spot on, doctor, on that because we personally help these providers from the scratch, the same way the others do. And at the same time, we take care of their credentialing work. We don't let them go for the headaches of billing. But again, at the same time, we show them the transparency of the guidance, educating them, consulting them, guiding them what exactly their business looks like. We actually guide them step by step the process. So even though if they wanted to go independently, maybe after maybe 2, 3 years or somewhere down the road, even they would like to go in-house, they should supposed to know what exactly their business or how it works, right? So we give them a clear picture of what exactly we can do for you, what exactly this business can get out of you, and that's the only reason we are doing this. So if, I believe, if there is a good group practice of mental health providers, or if there's individual providers who would like to go or think about it just for a second that they want to take the ownership, I believe we can put good, our efforts in that and help them out because that's what we're doing for a very long time. And I believe if there are currently providers out there who are working with these kind of platforms out there, I believe, and and if they're thinking to go independent, definitely, I believe they can reach out to us. We can help them out in any manner possible without just, giving them, that you are getting this reimbursement now. That's our practice. Instead of doing that, I believe we can actually give them the ownership of what exactly they're doing. And we actually can give them a clear picture, resources, help them out in any manner possible to make sure they can grow with us. And at the same time, they should supposed to, do what exactly they love to do, treat patients.
Mm-hmm. And most importantly, any good biller, such as Mohammed, is available 24/7 because you need a biller 24/7
True.
at 3 o'clock in the morning when you're trying to figure out what procedure to choose. You also need to know if the procedure is the right one based on the patient's insurance access, if that's actually going to be a procedure that you can do. And at 3 o'clock in the morning when you're trying to treat a patient, that's something that you do need to know. So you do need to have your biller available for emergencies at any hours all day and night, and that is Mohammed. And that is why you go to something more personal like a Mohammed versus a giant corporation.
I
You want
believe
some for you.
I remember you're saying like, billers are the kind of lawyers out there.
Yeah,
We're
yeah,
there
that,
to help them out in if they get into trouble. So
yes.
that's what we are.
You
Yeah.
are the lawyers of billing, and you know exactly everything that the doctors don't want to have to spend the time to know and know properly. That's why we lean on you so heavily. That is why you are needed. That is why I would highly recommend you or a service like you. because that is what is needed to do the job and do the job properly, which is what is the most important thing at the end of the day.
Right.
Follow your Hippocratic oath and let all the stuff that is not related to the Hippocratic oath be somebody else's headache. And Muhammad
True.
loves headaches. He wants to handle all of your headaches.
Yeah, thank you so much, doctor. Thank you so much for your kind words. And I really wanted to, tell the providers out there that we both are here to help them out, show them another picture, a big picture where they can decide that how they want the things to be down the road, right? So let's just help them out, help as many as we can out there, and lead them in the right way. Any thoughts before we leave and, keep this on the platform?
Sure. The best thing that I can say is all about experience, 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 and comfort with the person that you're creating a business relationship. A business relationship is like getting into a marriage with somebody. So
True.
you want to make sure that the person you're getting into with is somebody you'd want to have a beer with, somebody you'd want to spend some time with because you're going to spend a lot of time with your biller.
True.
Your biller will become your second wife, and that's not a joke. I
True.
can tell you more about my biller than I can about my own wife in terms of habits and weird things. That's just how much you are a part of our lives. So pick a good one.
True.
Mohammed is a good one, without a question. He will take good care of you. He will make sure that there's always money on the table to keep the doors open, which is the name of the game. And he'll hold your hand as you go through this process of joining the world of medicine. Welcome to the community.
Thank you, doctor. Thank you so much for this session. I appreciate your being coming out of. I know you had a very busy schedule, but thank you so much for joining this episode. I believe it's a
My
special one.
pleasure.
I thought it would be nice to actually do an episode for the providers out there too, with the normal folks out there in the RCM. We do this blueprint to help them out to get more dedicated people into this business. But it's nice to help them out too through this episode.
My pleasure. I always love to help providers, both existing ones and, more importantly, new ones that are joining the community, the right way to do things so that we all help the community and move forward together.
That's so kind of you, doctor. Thank you so much again for joining in
My
today.
pleasure. My pleasure. Have a great day. Have a
You
great
too.
weekend. Happy Easter, guys.
Happy Easter, guys. Thank you, everyone. Thank you for joining in.